मेरा नाम महादेव है। ये हमारे पिताजी है, सोमनाथ काशप्पा बोल के। हम बीदर डिस्ट्रिक्ट बसव कल्याण तालुके से बिलोंग करते हैं। हमें यहाँ पर एक बार सुपारी खाने से अचानक से सुपारी अंदर चले गए थे, तो हम बहुत परेशान थे। 3-4 महीने से तालुका और डिस्ट्रिक्ट प्लेस में बहुत सारे जगह पर हम वहाँ पर गए, बहुत सारे पैसे खर्च करे, लेकिन प्रॉब्लम क्या है बोल के पता नहीं चला। अंदर सुपारी है या नहीं है वो भी पता नहीं चला। तो टीबी का सभी तरफ से चेकअप करने के बाद भी प्रॉब्लम सॉल्व नहीं हुए, तो उन्होंने इमीडिएटली हमें हैदराबाद को यशोदा हॉस्पिटल सोमाजीगुड़ा में डॉक्टर नागार्जुन सर से मिलने के लिए बताए। तो हमें यहाँ पर आने के बाद इमीडिएट उसी दिन यहाँ पर स्कैनिंग सभी करा के एक ही दिन में वो प्रॉब्लम को सॉल्व कर दिए। बहुत अच्छा था सर, सभी फैसिलिटी था। यहाँ पर हमें किधर भी फिरने का और टेंशन लेने का ज़रूरत नहीं था, हर एक चीज़ का सुविधा था। और हमें टेस्ट के लिए और रिपोर्ट के लिए यहाँ वहाँ भटकने का ज़रूरत नहीं पड़ा। गुलबर्गा में इधर में एक दिन में हम सिटी स्कैन में इधर उधर फिरे हैं। लॉकडाउन में बहुत परेशान थे। यहाँ पर सभी सुविधा मिला और एक ही जगह पर बैठे जगह पर सभी चेकअप होके हम पूरे सर्जरी करके 12 घंटे में हम यहाँ से ठीक होके निकले। डॉक्टर बहुत अच्छा सजेशन दिए, उन्होंने क्लियर एक टारगेट बताए और सर्जरी कैसा रहता है, किस तरीका रहता है और वो कहाँ फंसा है, दिख रहे नहीं दिख रहे, पूरे डिटेल में समझा के सर्जरी के लिए लेके गए। वो 1-1.5 घंटे में पूरा वो जहाँ पर है वो कफा जमा हुआ था ना, जो प्रॉब्लम है वो दिख नहीं पा रहा था, फिर भी उन्होंने रिस्क लेके 1 घंटे में पूरे क्लियर करके भेज दिए। अब हम ठीक हो गए, यहाँ पर टोटली ठीक होके क्लियर होके निकले हैं।
I am Dr. Nagarjuna Maturu, Consultant Interventional Pulmonology at Yashoda Hospitals Somanath. I'll be sharing with you our experience in treating Mr. Somanath ji, who had come to us all the way from a district in Karnataka, Bidar. So he had come to us with an interesting history of accidental swallowing of a supari or a betel nut during his sleep. This happened almost 3 months before he had come to us. When he had come to us in the OPD, he was coughing vigorously. He was not able to talk. Every time he talks, he started coughing. And a CT was done before he came to us, which was actually showing that there was a block in the pathway to the right lower lobe. So immediately we had suspected that it could be the supari which he had accidentally swallowed, which got lodged in the pathway to the right lower lobe. So which means that half of his lung was actually blocked by the betel nut. Because he had come from a faraway place, we decided to help him as much as possible, and we had scheduled the treatment on the same day. After explaining to his son and him that this could be the cause, the same day we had actually performed a bronchoscopy. So bronchoscopy means it's a procedure where we will look into the lungs. So as we had rightly expected, we could see a large piece of supari. So immediately we had used a technique called as a cryo extraction. This is a new technique which is very helpful for removing such foreign bodies. This is called a foreign body. It's a foreign body in the lungs. So where we basically use a very small probe instrument, we freeze the tissue. So the betel nut is basically, the probe is touched, it is frozen, it gets stuck to the probe, and then the whole thing is removed. So by using these equipment, it's called as a cryo probes. It's a very simple and smooth procedure. So in a matter of 20 to 25 minutes, the whole procedure starting from identifying the piece to the removal of the piece was successfully performed without any complication. So the person had come in the morning to the OPD, the procedure was done in the afternoon, and he had gone back home on the same day. And the relief also is instantaneous. The moment the supari or the betel nut had come out, the cough completely vanished and he became his original self. So he had started doing all his activities without this fear of cough, without this cough troubling him, and all the fear of having tuberculosis infection, everything had gone away. So this is a very interesting case of a foreign body in an adult lung. We do come across this once in a while, and this is one of successful stories which we thought we should share. Thank you.